Just recently, British Columbia became the first province in Canada to decriminalize the adult possession of small quantities of certain illegal drugs. It's something the City of Toronto is also looking to do. As the city's top doctor says, we're experiencing a drug poisoning crisis. Officials in British Columbia say decriminalization is a critical step in the province's fight against a toxic drug crisis, which has killed thousands since 2016. As of last Tuesday, those 18 years and older found with up to 2.5 grams of drugs for personal use, including opioids, MDMA, and cocaine, will not be arrested or charged. Toronto is watching closely, hoping to follow in BC's footsteps.
Drug use is a health issue. And treating it as a health issue, I think, is a key step towards improving the health of those who use drugs and improving health in our community writ large.
It's been a significant challenge in Toronto. There were 296 deaths in 2019, a figure that doubled in 2021. In early 2022, Toronto submitted an application to the federal government seeking an exemption. Since then, both sides have been meeting regularly.
We want a made in Toronto model that actually addresses Toronto's unique circumstances. And we're not exactly the same as BC, so it has taken us some time.
For instance, Toronto is a city, not a province, seeking decriminalization. So what will it mean for other jurisdictions in the GTA? Dr. Davila also adding that substance use rates in the city differed compared to BC. But one thing remains.
Decriminalization is an important part of reducing barriers to accessing care, whether we're talking about medical care or other supports like housing supports or income supports. These are all important to enhancing and improving the health of individuals who use drugs.
The city's top doctor emphasizing that though decriminalization is an important tool, it isn't the only one, saying there needs to be adequate mental health, social and medical supports, and a need to address social determinants of health. A harm reduction advocate who has also dealt with addiction in the past says the same.
It's most important to address the root causes of addiction in general, including the systemic issues such as poverty, lack of access to health care, and lack of support for individuals who suffer from addiction.
Now, the final decision to grant the City of Toronto exemption is in the hands of the federal government. As to when that date will be is still unclear. In Toronto, I'm Faiza Amin for City News.